Hello, family. Hello. How are you all doing? I am sorry I'm joining you all late today, but I didn't want to miss another Sunday. So please jump on if you are available. I'm looking forward to us chatting today. Hey, Lee, thank you so much for joining. As you come into the room, please send me a wave or type your name in the chat, and I just love to welcome you here personally. So as you come on in, just send me a wave or type your name in the chat. Okay, thank you so much for being here. We're going to be talking about our hearts today. It's a month where we celebrate a lot of different things, and today is Valentine's Day. And so we're going to talk some about different things that are relevant for our hearts, both our physical hearts and our spiritual hearts. So as you come in, please feel free to type hello or wave. Hey, Monique, thank you for being here. I appreciate you. Thank you for being here. And we have Lee. Thank you for being here. I appreciate you. So as you come into the room, please feel free to like and share. And so today what we're going to be talking about is a physically and spiritually healthy heart. 3 things to check. Okay, 3 things that I want you to check. Hey, Number, happy Valentine's Day to you too. Thank you for being here. So thank you all. Okay, so we're going to get started. Again, I apologize for being late. Today is a special day. Yes, it's Valentine's Day. It is also the birthday of my youngest son. I have 3 sons, and my youngest son turned 15 today. So we were out celebrating him, and time just ran a little bit over. So I'm glad to be here with you all today, and looking forward to us chatting. Okay, so let me go ahead and get started. Thank you again for being here. I'm Dr. Madeline, your board certified OBGYN, international speaker, and published author. I help busy women access accurate GYN information and tailored GYN care, as well as birth control that they need so that they can have the most freedom and control over their lives that they desire. Please feel free to follow me on Facebook, Instagram, and Twitter at Dr. Madeline MD. That's DrMadeline MD. And again, I want to thank you guys for being here. So, hey, yes, hi, Dr. Kalechi. Thank you for being here. Happy Valentine's Day. Yes, it's also about the family too. You know, there are so many different ways that we celebrate love this weekend, actually this whole month. And one of the ways is certainly with romantic partners. It's also with, people who are related to us by blood, family, loved ones, encompasses a whole bunch of people. So just keep that in mind as you celebrate today. No matter how you celebrate, happy Valentine's Day, okay? So our topic today, a physically and spiritually healthy heart. 3 things I want you to check. And these are things that I think are important. They're things that I think of a lot or talk about with my patients a lot as they're talking with me about their overall health and all of that. And so one of the things, yes, Dr. Kalechi, that's one of the reasons I'm covering this topic today, because so in February, we're celebrating a lot, right, guys? We have Black History Month. We have Heart Health Month. We also have Sexual Health Month. And believe it or not, today begins National Condom Week. And so we're going to hit on that at the end as well. And so there's a lot that we celebrate this month. Earlier this month, we had National Women Physicians Day. We have new, for the first time ever, a National Black Women Physicians Day, which is now going to be February 8th. And so we just have a lot of good stuff. We have Valentine's Day today. So let's get started. What are the 3 things I want you guys to check or be aware of when it comes to your heart? So first, let's talk about the physical heart. So when we talk about heart health, we're usually in medicine talking about some things that we want you guys to be aware of so that you can have the healthiest heart possible. When you go to your provider, let's say you go in for your annual exam, you guys may be aware that there are some things that we tend to check pretty consistently to make sure that you are where you need to be. And if you're not there, then we usually talk about a plan to help you get there. So one of the things we always check is, as you guys know, we always check your blood pressure. What's your blood pressure doing? Is it in that range of like 120/80? Is it above that? Is it less than that? And so that's definitely one of the things we like to be aware of. Sometimes people can have just like isolated elevations with their blood pressure. Let's say you go in, and I hear this a lot from patients. They'll come in and see me and they'll have a reading that's, let's say it's 159/85. And it's always been normal. And so a lot of times the question is, well, do I need to respond to that single elevated blood pressure? And the answer is no, not necessarily, not unless there's something else going on. Do you also have a chronic headache that never goes away? Is there something else that may be letting us know that maybe you're going to start to develop high blood pressure on a more chronic basis? And so that one isolated blood pressure doesn't mean that you have to be aggressive in terms of starting meds or anything, but it's part of a bigger picture. What else might be going on? And a lot of times, if we follow back up with you in 2 months or 3 months or even 6 months, if that blood pressure is still elevated, then yes, sometimes we begin to have a different conversation. With one elevated blood pressure, there are also conversations about different things to consider in terms of shifting things in one's diet. I always have patients, especially the last few years, I have several patients who've decided to go vegan. God bless them. I still love meat, but there are many patients who've decided to go vegan, and it really works out well for them in terms of having great health benefits. So that's one of the things I want you to know in terms of your physical heart health. Definitely check your blood pressure whenever you can. If you do go to see your provider and you have an isolated elevated reading, and maybe it's going to be 6 months or a year before you get back to your doctor, then one of the things you can do is to go to one of the local CVSs or even the fire stations, have them, and just get a blood pressure reading just to see where you are. If you notice that you have an elevated blood pressure before your next appointment with your provider, it's completely okay to call them and say, hey, my blood pressure, I took another reading today. I was in a relaxed state. I wasn't stressed, and my blood pressure reading was still elevated. Then that's certainly something important to call your provider about to see if they want to have you come in beforehand. Okay. So that's something to keep in mind. The other number that is important for your heart health is your cholesterol. So when you have your regular visit, that's one of the things that we check when we send off for your blood. A lot of times we're checking to see if you're anemic, because that can also impact your heart health. We're checking to see what your lipid levels are. Cholesterol is one of them. We also look for LDL and HDL. And what we're also looking for when we draw your blood might be something that gives us an idea of whether or not you might have diabetes, and that's a hemoglobin A1C. And so when we look at those numbers, those are results that are definitely important to follow up on to see what they are, and they let us know whether or not we need to have further discussions. Is there something that we need to tweak? A lot of us these days are looking at the hemoglobin A1C as a way to tell whether or not someone might be, quote unquote, pre-diabetic, or they could be already diabetic. But what it does is it allows us to look at what's going on and then come up with a plan so that they can make some adjustments before that next medical visit. And when the lab is measured again next time, a lot of times it will have improved, and someone can avoid having a diagnosis that will affect them chronically. These diagnoses, they become so important, especially as we get older, as we are looking at different things and different activities we want to do, looking at different things that could affect our life insurance and all of that. And so it's important when you have these visits with your provider and you have these tests done and you have these measurements taken, if there's an opportunity to kind of shift some things to make an improvement, definitely talk with your provider about some of those opportunities and some of those steps that you can take so that you can be better when you follow up the next time and not have those same readings. Okay. So that's definitely something I wanted to talk about. The first thing I wanted to talk about in terms of the medical status in terms of your healthy heart. The second thing, and I touched on it a little bit already, is what is going into your body. When it comes to a healthy heart, now this is a tough one. I got to tell y'all. So I'm from New York City. My family, both sides of my family, from South Carolina. And so, I grew up eating some things that I don't necessarily eat now. And, and so as my cousins and I started getting older and maybe we cooked a little bit differently, there were always conversations that had to be had. For Thanksgiving now, I no longer cook with pork. I cook with turkey, but that's a shift for people. But it's important when we get to the point that we are, very concerned about our heart health. And a lot of us, again, we need to be concerned because there are some things that we can do to modify how our heart is behaving. So definitely what goes into our body is one of them. Now, I mentioned to you earlier, some people like to give up meat altogether. And so that's why you might see more and more of your friends going vegan. Vegan folks don't eat meat or fish. If someone is pescatarian, then they eat only fish and not the beef or the chicken or the pork. And so, oh, hey, Mark, thank you for being here. Oh, you're so kind. You're Harlem's finest too, darling. Hey, Janet, thank you for being here. Another Harlemite joined in for today. So those are definitely two things that I want you to think about when you're thinking of your physical healthy heart. Your medical status, so checking blood pressure, cholesterol, hemoglobin A1C, lipids, what are they doing? If you're anemic, then your CBC would tell us that. And sometimes you have to take iron supplements to help build up your blood count. The second thing is what's going into your body. Are you eating things that could cause more stress on your heart? As we get older, things like things that have high fat content are not good because they can cause the vessels around your heart to not to become thicker, and the blood has more difficulty flowing through. And so that's something else to keep in mind. So what's Oh, Mark. Okay, so Mark is a vegan too. Okay, good. Mark is I don't mean to. I'm not a vegan yet. So good. Love you too, Mark. Thank you for being here today. I appreciate y'all. And so what's the third thing I wanted to talk about? So with the three things I wanted to talk about in terms of a healthy heart today, I said we would check three things. The first thing I want you guys to check, if you haven't already done it with your provider, is your medical status, knowing what those numbers are. Blood pressure, cholesterol, hemoglobin A1C, all of that, whether or not you're anemic. The second thing I want you to give some thought to is what goes into your body that may or may not be contributing to your healthy heart. Again, as we get older, different things are processed in our body differently. And so we have to be more careful in terms of what we're putting into our body. Again, that's why a lot of people, and Mark has joined on for today, and Mark says that he is now vegan. So, type in the chat, Mark, how it's going for you. I think you've been vegan for a while, if I'm not mistaken. So congratulations. So the third thing I wanted to talk about today, in terms of the third thing to check with your healthy heart, is your love. Okay, so love always, for me, it has to start with self-love. I wanted to start that way for all of you too. Self-love is sometimes more difficult than many of us like to talk about. So self-love is, just really taking some time to look at yourself, see who you are, and just make sure that you're comfortable in the space with just yourself. Sometimes to get to a space of really reflecting, you can do something that allows you to have some quiet time for meditation, whether it's, sitting with a candle, going for a walk by yourself, getting away out of town on your own. These are things that I like to do, and other ladies that I take care of tell me that those are some of the ways that they get to spend some time with themselves and really figure out what's going on and really embrace who they are so that they can have self-love. So always start with self, okay? And we can spend some time during the week talking about other ways to really begin to explore what self-love looks like. So what's the other thing? Consider how you love others. So we are celebrating Valentine's Day today. And like I said, yes, I want you to start with self-love, but many of you may also have partners. Love is important whether you are solo or whether you're partnered. Okay. When you're partnered, sometimes love involves sexual intercourse. I have a patient who called me last week and she said, hey doc, I was out there doing my thing, enjoying some self-care time, spending some time with me. And I ran into someone who I really liked. I enjoyed his company. And so she spent some time with him, and she was like, I happen to have some condoms in my bag, and but we did what we do. That is completely fine. So I want to definitely make sure that you ladies know that there should be no judgment involved with whoever you love, okay? And however you decide to do that love. One of the things that I wanted to share with you is that CDC a couple of weeks ago put out some data that talked about STD rates. Mark said, Valentine's Day. Oh, I thought you were wearing your Delta red today. This is kind of like a rust color sweater. So CDC put out some data talking about STD rates in the country. And nationally, STD rates have gone up every year for the last few years. So why is that important? That's important because if you are romantically involved or having intercourse with someone who is not a monogamous partner, mutually monogamous partner, then it's important to consider whether or not you need to take condoms when you have these encounters. Now, a lot of times my patients know that I love to have the condom conversation because things can happen. The data that CDC put out said that 1 in 5, it said that for every 5 persons in the United States, 1 of them has an STD. When they talk about STDs, they're talking about chlamydia, gonorrhea, syphilis, HIV, HPV, herpes simplex, and trichomonas. So I share that information with you guys, not to scare you, but just to make sure that as you're out there enjoying yourselves, living your best lives, I want you to have fun. I want you to have fun and healthy sex lives. But also keep in mind that if you're with someone new, if you're with someone with whom you haven't been screened to know whether or not either of you has STDs, then consider whether or not you want to keep a condom with you in case love takes you to a place where you guys are having sex. Then at least you're prepared and you're ready. Okay, so those are the 3 things I want to talk with you about today as we talk about heart health and the ways that you can check your heart health to make sure that your heart health is in a good space. So the first thing, again, your medical status, knowing what some of your numbers are. When you go to for that visit with your provider, just make sure you jot down those things so that you can know what the numbers are. If you ever, have questions either of your provider or, even if you have some here as we're talking on Sunday afternoon. If you have questions, if you know what your numbers are, then we can know where you're starting from. And we can go from there in terms of recommendations and guidance. What's going into your body? If you do have numbers that are not where you want them to be, if your cholesterol is high, if your blood pressure is higher than you want it to be, if your hemoglobin A1C is of concern, then this second thing to check can help you adjust those. So when we talk about what's going into your body, do an assessment to figure out, a lot of times when someone's hemoglobin A1C is elevated, yes, a lot of this stuff is genetic, but there are some things that you can adjust to help counter some of the genetic impact. So if your hemoglobin A1C is elevated, definitely things that reduce the number of carbohydrates that someone is taking in. When I say carbohydrates, I mean the rice, the potatoes, the breads. Those are things that can be helpful with reducing the hemoglobin A1C. And also mild exercise. So exercise can be 20 to 30 minutes a day of walking or just any light exercise. Weight-bearing exercises are great too, and you can add those in after you start with the 20 to 30 minutes of walking each day. And, thank you, Mark. Thank you so much. And so that's, I think, really important in terms of what's going into your body. Also consider, a lot of people have made the change that Mark has made in terms of going to the status of being vegan. And, read about it. If that's something you want to try, definitely give it a try. Sometimes I think we're very hard on ourselves when we try to make some of these adjustments. I was talking to a patient a couple of months ago, and she described to me what she did. She does vegan most of the time, but allows herself to go away from her vegan diet for special occasions. And it's okay to do that. It's okay to say, you know what, this is what I'm going to do most of the time. And on these times here and these special occasions, I'm going to just enjoy myself. I'm going to eat whatever I want. And that's okay to do too. So anything in moderation. You know, if you adjust your diet and you see the changes happening with your numbers that you would like to see, so that you're no longer in a risk zone for diabetes or chronic hypertension, then definitely consider which things you want to make long term. I don't know if Lee is still on here, but there's a program that she turned me on to a few months ago called Optavia. And yes, Allison, anything in moderation. And it's basically a program that you eat certain things during the day. And it really is great in terms of weight loss and helping to get the numbers under control and bringing some overall health back to your heart. So I can certainly give you more information on that if you're interested, or if Lee is still here. I think she may be gone for the day, but okay. And lastly, the third thing I told you guys that I wanted to talk about was the third thing to check, and that is your love. Start with self-love. Consider how you love others. If your love with someone else involves sexual intercourse, please keep in mind that STDs are at an all-time high, and determine whether or not you want to use a condom with that partner if they're not a long-term mutually monogamous partner. Okay, just something for you guys to consider. Something else I want you to consider, because you know, I worked in public health for a long time at CDC. The recent numbers that we have for STDs are from 2018. We'll soon have 2019 numbers. So I want you to also consider that in 2020, we were facing a pandemic, a huge pandemic. You know, COVID-19 really shook everyone out of what our norm was. So in public health, whenever something like that happens, other programs usually will suffer some financial rearrangements. And so what does that mean? So the public health team that was working on STDs, and again, this is not to scare you, I'm just giving y'all real talk. The public health team that was working on STDs, when COVID-19 happened, they had to shift some of their resources to work on COVID-19. So whenever I'm reading about updates with sexually transmitted infections and all those things, I'm reading very frequently about how manpower had to shift from all the different STD screenings that were going on and some of the contact tracing for STDs that go on. Some of that had to shift to COVID-19, you know, contact tracing and all of that. So, hey, Sharon, thank you so much for joining. You're very interested in the program of moderation. Excellent, excellent. Okay, we can talk more later if you want to share some more details about what you have done, or even hear about some of the things I've heard about that have worked really well for folks over these last few months. Happy Valentine's Day and a happy birthday to your son. Thank you so much. Thank you so much, Sharon. I appreciate that. So, so I want you guys to consider that for 2020, remember I said the STIs have steadily been increasing over the last few years. For 2020, we will likely see another increase, primarily because people haven't been able to access some of the public health resources that they would usually access. And so it's possible that some people have been walking around undiagnosed and untreated. It's possible. Another thing I want you to keep in mind is that about 50% of STDs are asymptomatic. So someone can walk around with an STD and not know that they have it. And so again, that's another reason why I always encourage carrying a condom just in case you see someone who sparks your fancy and you want to go in that direction, then at least you're protected. Okay, so that's all I wanted to cover for today. I do hope you guys have a wonderful Valentine's Day, whether you're spending it solo or with a partner. I hope that you have joy in whatever it is you're doing. Again, if you're solo and you're just spending time with yourself, you know, whether it's lighting a candle, treating yourself to some flowers, taking some time with a glass of wine and, you know, relaxing in a bathtub or something like that, that's wonderful too. If you're partnered and you're going to do something special with someone who has a special place in your heart, then that's a beautiful thing as well. So I hope that whatever you do this Valentine's Day, that you have a great rest of your Valentine's Day. And I hope that the three things I want you to check, that you keep them in mind so that you can have the healthiest heart possible. Remember that heart disease is the #1 killer of women, more so than all the cancers in this country. And so I absolutely want all of you to have a healthy heart. Okay. So again, just to summarize, for your healthy heart, I absolutely, hi. Oh, thank you so much. Thank you so much, Janet Spooner. I appreciate it. Oh, thank you, Mark. I love you too. Thank you for being here today. So again, the 3 things I want you to check for your healthy heart. 1, your medical status, and we talked about some of those numbers, okay? 2, what's going into your body, foods that you enjoy, but also foods that can help impact those numbers in a good way. And 3, your love for self and how you love others, okay? So I am grateful for you all being here today. I am going to go back and continue celebrating my Valentine's Day. I wish the best Valentine's Day for all of you as well. And I will pass on to my son that you wished him a happy birthday, okay? I love you guys. We'll see you next Sunday, all right? Okay. This is Dr. Madeline. I'm signing off for today. I'm your board certified OBGYN, international speaker and published author. I love helping busy women, whether they're busy outside of the home or inside the home, access accurate GYN information, tailored GYN care, and birth control that they need so that they can have the most freedom and control over their lives that they need to be able to get stuff done that they need to get done. Okay. If you have any additional questions or want more information, please feel free to follow me on Facebook, Instagram, and Twitter at Dr. Madeline MD. That's DrMadeline MD. Thank you so much, y'all. Happy Valentine's Day. Mwah.